Hi, I'm Harvey Hahn. I'm a cardiologist with the Kettering Health Network, and today I'm going to be talking about how to take the die out of diet, or basically which diet reigns supreme. All right, let's start with a math problem. I know you all like math. Suppose you have 10 chocolate bars and you eat 9 of them. What do you have? Probably diabetes. All right, and this highlights one of the big problems. Diabetes type 2, heart disease, and most chronic diseases, about 85% of that is lifestyle mediated. It's not your genetics, it's the choices you make. And those make a huge difference on your overall health. Now, this is a great quote that I love. Basically, when diet's wrong, medicine is of no use. When diet is correct, medicine is of no need. And this is really true. There's some people that are really sick. If you're smoking, eating bad food, not exercising, there's not enough medications that we can pump into you to fix everything. All right, your lifestyle makes a huge difference on the amount of medications you make and your overall health. Here's a great quote from Dean Ornish. Heart disease and diabetes, which account for more deaths in the US worldwide than everything else combined, are completely preventable by making comprehensive lifestyle changes without drugs or surgery. You can become undiabetic, unhypertensive, unhypercholesterolemic if you really want to. Now you have to ask yourself, what way is easier here? Should you make some lifestyle choices, eat better, sleep, exercise? Or should you come visit me, we crack your chest, and we do a bypass surgery? A lot of these choices are totally in your own power. Now, one of the things with diet that really gets people confused is just which diet to follow. Now, there's so many different options: Ornish, paleo, keto, low carb, vegan, plant-based, DASH, or Mediterranean. Now, why are there so many different diets? Think about this. If I said, hi, I'm Harvey Hahn, I'm a cardiologist, and I'm just like every other cardiologist, who's going to want to see me? The diets have to show that they're different and that this time it's going to work for you. All right? They're not showing what's similar, they're showing what's different. But what we're going to talk about is some really core principles that cut across all these different diets that can really help you get healthier. Now, here's a really interesting study that looked at 4 popular diets. And what's really frustrating is at the end of 1 year being on any diet, you only lost about 10 pounds. Now, most people would not say their weight loss goal is 10 pounds. So if you invest 1 year on a diet and you only lose 10 pounds and you're miserable the whole time, you're going to quit. It's just not worth it. Now let's think about this other thing. What's better? An apple, applesauce, or apple juice? Obviously the apple. As you get more and more processed, things get added, chemicals, preservatives, but also good things like fiber get stripped out. Here's another great example. Corn on the cob, corn in a can, or high fructose corn syrup. Obviously we know that high fructose corn syrup is not good for you. This is the process of highly processed, highly preserved foods, which are not good for you. Now this is important in America because if you look at this graph, 2/3 of what Americans eat is processed foods. It's in a bag, box, or a can. It's not fresh. It's been manipulated, altered in some way to make it last longer and get it to you easier. And this is why you can shop out of a gas station and just buy all these convenience foods. Another way to look at this is glycemic index. One of the big problems you have is you eat, you pump up your sugar, your body pumps up insulin to get the sugar back down, but that also makes you gain weight. Insulin is a growth hormone that makes you gain weight. So look at these foods here: bread, whole wheat bread, or salad. What you can tell here is the more refined, the more processed you get, like the white bread, the glycemic index or the sugar load goes up. Now that's going to stimulate a bigger insulin spike as well, and that's going to stimulate more weight gain. So the less processed, more whole foods you eat, the better it is for your body, the less insulin you secrete. Now, this has been proven in lots of different studies, but I'm going to show you this one. If you look at the bottom graph, the low glycemic index, LGI, those people maintain or lose weight. The high glycemic index, HGI, those people's weights are going to the moon. All right, that's not what any of us really want. Now, one of the big things people are going to talk to you about is carbs are bad, don't eat carbs, etc. Here's a really interesting study by the Tusami tribe in South America. And what they did is they actually took a CT scanner on a boat, went to their tribe, and scanned their hearts. And what they found is that the people in this tribe, which is very remote, isolated, they have the most healthy vascular system in the world. Compared to Americans, their vascular system is 28 years younger than Americans. Now, what's interesting is their diet is 70% carbs, mostly fruits and vegetables, but it's all unprocessed. And that's probably the biggest difference. You guys know who Grok is? Not the football tight end, but that's the little dancing caveman for the paleo people. And so this is the Paleolithic food pyramid. And what you see at the bottom, the foundation, is what? Fruits and vegetables. So paleo actually is a whole foods, plant-based diet, but people tend to focus on the meat part of it. Now let's talk about meat. There's multiple studies, mostly observational, that show that the more meat you eat, the worse off you're going to do. There's a combination of 2 meta-analyses that looked at this. And basically, every time you cut off one meat serving and replace it with fish, dairy, beans, poultry, whole grains, or nuts, you decrease your chance of dying. Every time you add an extra serving of processed meat or unprocessed meat, you increase your chance of dying. Just to be clear, the other white meat, pork, is actually worse than red meat. And that's why things like bacon, ham, sausage are really not good for you. Now, people get irritated and say those studies aren't that good. They're just surveys. But they've actually found what the mechanism is of why eating meat hurts your arteries. And we're going to go through this. On the top left of this figure, you can see that if you eat meat, you actually give phosphatidylcholine to your gut. The bacteria in your gut break it down and make TMA. That gets absorbed into your body. The liver converts TMA to TMAO. That goes out and it actually irritates your arteries and makes you have grunge develop in it. Also, it turns your platelets on and makes your platelets sticky, so it's easier to clot. Now, the great thing about this study is they did 2 separate things. One is they gave antibiotics and they killed all the bacteria in the system. No bacteria, you can't make TMA, so you have no more TMAO. What they also did is put these guys on a vegan diet. If you're not giving the guys meat, the bacteria can't convert anything, no TMA, no TMAO, decreases your vascular injury. Now, the great thing about just not eating meat is you can decrease your TMAO production without the antibiotic-associated diarrhea you get. Now, don't listen to me. I'm a cardiologist, but there's lots of cardiologists that also believe this. This is Kim Williams, who is the past president of the American Heart Association. And I love this quote. There are 2 kinds of cardiologists, vegans and those who have not read the data. Now, he changed his mind. He tested his cholesterol one time in this point-of-care cholesterol test, and it was high. So what did he do? He checked it again because he didn't believe it. It was high again. Then he started thinking, should I get on a statin? Or is there anything else I can do to get my cholesterol down? So he started doing some research, reading the literature, and he went on a vegan diet. Lost 35 pounds, cholesterol is now normal. This shows the power of diet. Now, this has been studied very well. It's a very interesting study here. Basically, there's 2 groups of people. One group got Mevacor, which is a generic statin. The other group was just put on a vegan diet. And within 2 weeks, both groups had dropped their bad cholesterol by 30%. When I went vegan, I dropped my cholesterol by 50%. So it's been published. It works repeatedly. Now, here's a great graphic example of this. So in the movie Game Changers, they have 2 groups of football players. One group eats bean burritos. One group eats a chicken burrito. And then they draw their blood, they spin it down, and then they show this. So on the left, the guys that ate the bean burrito, you can see their serum level, that yellow fluid, is nice and clear. The chicken burrito people, it's murky, filled with triglycerides and fat. Now start thinking about this. Every time you eat a meat-type meal, you have all this fat in your serum. That's coming into contact with all your blood vessels all over your body. Think about how that's going to make more and more grunge grow inside and block up your arteries. Great example. Now, going back to the beginning slides, we talked about the choices we have to make. Look at this cartoon. So you have 2 choices. We could perform a triple bypass surgery where you take a vein out of your leg, open up your chest so we can sew the vein into your coronary artery. Costs $100,000 and you'll be laid up for 2 months. Or we can put you on a vegan diet. What does the patient say? A vegan diet? Gee, doc, that's pretty extreme. You can make some lifestyle changes that have a huge impact, or you can let us have a huge impact on your life. It's your choice. Now, some references for plant-based or vegan living. The China Study is a great book. This is the book that changed the trajectory of my family's health life. My wife read this. She's the one that converted us to becoming vegan. Our whole family's way healthier now. Game Changers is a great movie talking about athletics and a vegan diet. Highly recommend that. But the movie I think that's the best to watch, it has the most actual data, is Forks Over Knives. And that's really well done. These are not boring documentaries. I think you'll enjoy watching them. Now, just because you're plant-based or vegan doesn't mean you're going to be healthy. You can do it wrong. So in this study, they actually looked at people that were having a plant-based diet, but one group was kind of healthy, unprocessed food. The other group was eating processed food, and they did worse. Just because you're vegan or plant-based doesn't mean you're going to be healthy. It's also the quality of the food you eat. Now let's go back to the processed, unprocessed thing one last time. This is a map of Kroger's and where you're supposed to shop in Kroger's. The periphery, the outside of the store. And the reason for that is the stuff on the outside is the fruits, veggies, perishables. They don't have preservatives or as many preservatives, so they have to be restocked multiple times a day. The stuff in the middle of the store are a bunch of boxes and frozen stuff. They can stay there for months, no problem. Now, having said that, the middle of the store is still useful for something. It's really good if you want to stock up for the zombie apocalypse. But remember, even Twinkies have an expiration date. Now look at this. This is a great study that was published in the New England Journal of Medicine. And they talk about foods that make you gain weight and foods that make you lose weight. If you look at the table on the left, you can see the potato chips, processed meats, unprocessed meats, butter, sweet desserts, refined grains, processed grains. They make you gain weight. If you look at vegetables, nuts, whole grains, fruits, and yogurt, they make you lose weight. Once again, this is about processed, unhealthy food versus whole foods, and they make a huge difference on how much weight you gain or lose and your overall health. So finally, if you look at all the evidence we've talked about and a lot of evidence we didn't talk about, the commonalities of these diets is this: whole food, plant-based. That should be the foundation of what you eat. Less processed food, the bad carbs. If you get rid of the snacks that are in bags and things like that, you have a huge drop in weight and get really healthy. Less sugar, another bad carb. Most of this is in soda or juice. Limit red meat or eliminate red meat, go vegan. Fats are good for you as long as they're good fats, not the bad fats. And finally, eat good carbs. Fruits are good for you. Now, there's a big meta-analysis looking at the same thing that I just kind of reviewed, and they boiled it down to one sentence, which I think is really, really good. This is what you should eat. Food, not too much, mostly plants. That's a good mantra to follow as you're thinking about what you want to eat every day. So we talked about what to eat, even talked about where to shop around the store. In another episode, we're going to talk about when to eat, and that talk's going to be about intermittent fasting. All right, everyone, good luck, and hope to see you again.